Good morning and welcome to Focus Today. I'm Steve Johnson in for Perry Atkinson, and we've got a guest that you probably are becoming more familiar with. We've talked to Dr. Joel Klein several times now, and it's good to have you back in the studio. It's finally nice to be able to meet you at this point with Ventana Wellness. Your history, you're from the East Coast, Maryland,
yes,
right?
As people can probably hear in my voice.
You know, I haven't been able to detect that too much.
Well,
because you've never said, forget about it.
No, because it's not New York, it's Maryland.
Well, there's a difference right
Yes,
there.
a little different accent.
We're going to be talking about something that I think impacts either us or our families, and I think people are concerned anyway. Let's say a generation ago, maybe two, cholesterol really wasn't on the radar. We really didn't know that much about it until Jim Fixx's book, the book that it showed his legs and very muscular. The guy was a runner,
right.
And then he dies of cholesterol, high cholesterol.
It's
right?
been on the radar for a long time. When I was a medical student in the 70s, I was being told to treat people for their cholesterol, and then the only drugs that we had then were this powder that constipated people, or
really?
Oh yeah. So I'm always going. I was going. Why am I doing this? I'm making people feel worse to treat a blood test, and it was like not great. But it's been on the radar, and that's the point. It's been on the radar for actually 50 years, and that's part of the story that I tell. That it's been made the major issue, where it's becoming evident that maybe that it doesn't appear to be as big an issue as was originally thought, but it's taking a while for that to filter down.
Well, and we've also had some issues dealing with those types of things where misinformation or just research that wasn't complete or changed slightly that we've kind of looked at. So it's kind of an evolving situation that we're at, right?
Always, because even in science we have something called confirmation bias.
Express that, because that'll give us a good insight.
It's a fancy way of saying seek and ye shall find. Basically, it's that even scientists are still people and will still tend to look for evidence that confirms pre-existing beliefs.
Even that's good if they're good. If they're right, but
well,
not
that's
so
the whole
good
point. How do we show are they right? Because a basic tenet of science is you cannot prove things to be true. You can prove them to be false, and by doing so, hopefully, you get closer and closer and closer to the truth.
So eliminate the false, and you've got more truth.
You get closer. That's the general idea. But the problem is then that conflicting evidence is frequently swept aside because it doesn't fit with the prevailing belief system, and I think that's a big part of the cholesterol story over the past 50 years.
You know, and I think we can talk a little bit about some of that stuff because we've heard of bran, oat bran specifically, good, then not quite as good. Not that it was bad, but it just didn't do all the hype that was there. And then others come back to say, well, no, it really is good for you. So I do want to get into all of that. But let's first define a little bit this whole cholesterol thing. My situation was in the 20s. My cholesterol was, and even the ratings have changed, the good and the bad. We only had one, I think, at that point. Maybe that shows how old I was. But it was just, if it was lower than 200, you were fine, whatever that rating was. And then we divided it out, the good and the bad, and almost like a movie by Clint Eastwood.
Yeah,
we didn't quite have
the bad and the ugly. Well, no, we have the ugly. Yes, we do.
We do. Okay.
Oh,
well,
yes.
So as I got older, my cholesterol went up, and I'm on cholesterol statins, and I know some people don't like that, but that's what I'm on now. And so I think people realize that it's one of those progressive things that if you didn't have it at one point in your life, that doesn't mean you're not going to have a problem with it later on in life. And it stems from an inflammation, right?
Well, no, cholesterol, it possibly.
Okay.
See, the issue here is whether
cholesterol
is really the issue or not. In people who do not, that's what I'm talking about next Thursday.
It's getting more mysterious now.
Well, this is where I think confirmation biases come into, and the problem is this all started with an association found between high cholesterol and increased deaths from heart disease. This is what most of the scientific studies all have to do with, this association, and this is why you hear all this conflicting evidence every year that one study conflicts what another study says, because most of these are statistical association studies.
Okay.
And as a physicist patient of mine correctly said, association does not equal causation. Just because things are associated doesn't mean one causes the other. Or as Dr. John Lee said, just because seagulls show up on the beach every time dead fish wash up doesn't mean the seagulls killed the fish.
Okay.
But in medicine, we tend to draw these associations. They say, well, 30% more of coffee drinkers had 30% more pancreatic cancer. Remember that from the early 1980s?
No, but I'm sorry to hear that.
Well, but it was found to be, again, it was an association that when they really looked at it, didn't come out. So you have all these types of issues. And the cholesterol business has been that for a very, very, very long time. And it turns out when we treat people preventatively who don't have heart disease with cholesterol-lowering medications, it really doesn't do a lot.
Really?
Yes. This is what the data is showing. This is what the real experts are saying. It's making some difference, but it's not nearly what people believe. And even the more conservative medical authorities are saying we think the adverse effects are being minimized in some of these studies and are actually recommending that they be used with caution.
All right. Well, with then this big question mark,
Right.
or I should say probably quite a few question marks now
A lot
above
of them.
cholesterol. Yeah. Is there an inflammation connection? What we call something inflamed. I normally think of like a sore throat.
Right.
An inflammation. We think of it that way. But I know that blood vessels can be inflamed and you
Right.
don't even know about it. Is this a connection that makes sense?
Yes, and there may be an indirect connection there. So the inflammation is a normal body reaction. It is what allows us to heal when we're injured,
Okay.
and
Right.
it fights off bugs. When it's out of control, it causes damage to the tissues. And there's a lot of evidence that it is low-grade inflammation in the blood vessels that is the real trigger of heart disease. And then the cholesterol gets swept up in the inflammatory process. So the cholesterol is almost like an innocent bystander being dragged in, but it is not the cause. Now, your body, cholesterol is actually a protective compound made by your body.
I've heard that.
I call it body
so
armor.
Strange. Okay.
And so stress, bad diet, all kinds of things, hormone imbalances will raise cholesterol. Cholesterol is also anti-infective. It actually helps your body fight bugs. So an elevated cholesterol could be, in some instances, a response to inflammation. And that may be where some of the connection with heart disease, but we're barking up the wrong tree.
Again, we're looking at cholesterol saying that's the cause, but it may have been something else.
It's an effect, actually. It's another effect of the underlying cause.
Okay, I want to stay with the cholesterol theme, but
Right.
I have to ask you about the inflammation of, let's say, blood vessel walls
Right.
that you say may be causing heart disease. What if it's not cholesterol? Let's just say perhaps that's off the table at
Right.
this point. What is causing that inflammation in the first place?
Well, what's causing the inflammation is diet, stress, and environmental toxins, with diet probably being number one. And stress, actually, and stress hormones. And some of it we still don't know is whether, again, it can be an indirect effect, whether that stress is depressing our immune system, making us more prone to viruses and other bugs getting in there, promoting the infection or promoting the inflammation. And this is still, we really don't know what causes heart disease per se, like the real cause. We have all these associations and factors, and that we think point in this direction.
Well, this is fascinating. I mean, I think that sometimes we look for a doctor with all the answers, but sometimes the questions actually produce more of the answers than just say, here's what we know definitively, and then 2 months later there's a new study out.
Well, we're all trying to come up, and the truth is, with the best answer in the situation, and the people making decisions, quite frankly, are usually looking at what policies, what practices can be employed in a population-wide basis, not individualized, but in a population, because they want to be able to standardize the practice of medicine. What things can we do to everybody that will do more harm than good?
Yeah.
And yet we have a lot of ability to individualize these things in a number of ways. Unfortunately, that gets a lot more expensive to do that.
Okay, of the three things you mentioned that can cause heart disease, the toxins, the stress, and the diet.
Right.
Toxins, we might not be able to control that as directly. That's kind of difficult.
Right, that's kind of tough in our world today.
Stress, we can try to do it, but there can be factors outside that cause that. That can be controlled too. But probably the easiest is the diet thing. So let's hit on that. And we're getting into more heart disease here, but it's all tied in.
It's just one more manifestation.
In the diet, we're told to keep away from sugars and fats. If I were to really make it simple.
Well,
you're looking at it more complicated than that. So what is it in the diet that is a problem?
First of all, fat is not bad. I will talk about that in my talk.
And there are different kinds of fat too.
Exactly. So the whole point about saturated fat being bad for you.
Oh, okay. I've always heard that's bad. Yeah.
Before 1900, as far as we can tell, heart disease and cancer were actually relatively uncommon. By 1940, they were the number 1 and 2 causes of death. What fat did people use for cooking before 1900? Lard,
yeah.
Saturated fat.
Sure.
Now, the original scientific studies where they decided that saturated fat was bad was when they fed mice supposedly saturated fat that we now know was hydrogenated vegetable oil. So biochemically that becomes saturated, but it's not real saturated fat. It's a chemical compound that did that. So it's probably, and I talk about this, the absence of the healthy fats in our diet that is more a contributor to heart disease. And in fact, when we eat the meat of grass-fed animals, we get those healthy fats. Animals fed with corn don't make those healthy fats in their meats.
Oh, really?
So maybe it's probably the absence of healthy fat rather than the presence of saturated fat that is the problem.
Okay. Wow, that's going to change the way that we look at the labels too, isn't it?
Yeah, but all the people who instinctively felt, look, my father ate 2 eggs a day and lived to be 92.
And had lard with...
exactly. Eating cholesterol does not affect your cholesterol.
Right,
at all.
I know that.
Yes, but so the fat issue is, maybe by eating too much fat, it's because of the calories. And yes, if you eat too many calories, because fat's very dense. But the fats themselves are probably not the problems, but the hydrogenated fats and the absence of the healthy omega-6, omega-3, and I'll even throw a monkey wrench in omega-9, which, but that's olive oil.
Oh, gotcha.
Olive oil and avocados, and those are medicinal medicines for people with blood sugar issues and the like. So those are very helpful.
Wow. We've just opened this box a little ways. We're going to get into it a little bit more. Dr. Joel Klein is our guest today, and you've got you're going to be speaking on Thursday night. Is that right? Or,
yes, a week from tonight.
Today?
Yes, at Smullins Center at 7 o'clock.
Let's get into this right now about where you're going to be. A week from this Thursday, you're going to be at the Smullins Center speaking about cholesterol, right? And I suppose, do you have cholesterol myths and facts or something like that?
Yes.
Is that what maybe we should come up with a name right now.
Well, I have to apologize. They come up with a little bit of a different name for it. My original name, was a little bit kind of tongue-in-cheek, saying why almost everything you know about cholesterol is wrong.
Oh, I like that.
But
that's a great name for a book.
Right. Yeah, it's a little wordy, but it's really dispelling myths about cholesterol.
All right. Well, we've been talking a little bit about that, dealing with inflammation and how that can have a factor. Or is it inflammation and cholesterol? Let me get this straight here. Is it the inflammation that's a problem that cholesterol feeds into, as opposed to cholesterol causing the inflammation? These are some of the questions being asked at this point. Let's talk a little bit about this. I have not heard the statistics on this, but tell me if this is true, that half of all heart attacks in the U.S. occur in people with normal cholesterol levels? Is that
yes,
right?
However, and I haven't looked into this in detail, that's probably not true now, only because what they're calling normal cholesterol, they keep decreasing the number.
That does keep changing.
In order to make that, but that was at some point, yes, people without a significantly elevated cholesterol. Correct.
I still get the idea that you were mentioning in the 70s when you were going through medical school and you were talking about cholesterol, things have changed a little bit, the standards and what we know about it, but it's been actually around even longer than that as far as being in training. I suppose in the 60s, were they training at that point? And I think for a lot of us, cholesterol was a relatively new thing from the 80s. It wasn't on our radar, but it looks like, is this still a big changing factor in the medical field as opposed to others?
Not in the, very, very slowly, but for reasons that may involve as much politics as anything else.
Oh, that doesn't happen in the medical
No, unfortunately not. All debate about cholesterol stopped in about the mid-1980s.
Oh, it did?
And for a number of potential reasons.
But they still are changing the rules and
yes, but they keep,
they're
narrowing down the numbers to less and less and less to try to incorporate, because if you get it lower enough, sooner or later, you may decrease a lot of the heart attacks. But the problem is, data that we have from the 70s shows that when cholesterol is too low, deaths start to increase again, predominantly from things like cancer. And that's not being paid attention to.
Wow.
And that comes from a study when they screened 300,000 men across the country in the late 70s for this study that they did that was called the Mr. Fit trial. It was multiple risk factor intervention trial. And they screened 300,000 men for that study. So they got all this data.
Yeah.
And that was where they came up with that 240 number, above 240 being high risk. But what nobody pays attention to is that also showed that cholesterol is below 160, and particularly low below 140, there was a dramatically increased death rate started to go up again from things like cancer and even suicide and accidents. And people say, well, what's that got to do with it? Well, cholesterol is the most abundant compound in your brain. So with too low of a cholesterol, then brain function probably starts to deteriorate as well.
And I think for a lot of us, we've heard the lower you can get your cholesterol level, the better. But that can be a problem.
Cholesterol is essential for life. Without it, we would die. So just like anything else, it is not bad, but there's a range. But yes, I disagree with that. And now, if we're saying for heart disease, yes, but we're not looking in a total view. And cancer is just about to catch up to heart disease in terms of deaths per year, and that's not being paid attention to either by the oncology community or the cardiology community, from what I can tell.
All right, and so while some of us are saying, well, heart attacks are one thing, strokes are another, cancer is another, cholesterol another, this symbiotic relationship of how one can result from causes that might be impacting another, it really all ties in.
Everything's connected to everything else. This is not a new concept.
Yeah.
However,
but have some doctors only treated one thing for one thing? Here you've got cancer without saying, hey, let's...
Well, this has been a trend in medicine for over 100 years that people focus on certain areas. And there aren't as many people looking at, well, how are all these things connected? There are people who are doing that, and there are people who are looking at how the nervous system, the hormone system, and the immune system is what's involved in inflammation, are all completely interconnected and working with each other. And for lack of a better term, they're calling the science neuroendocrine immunology, because we just don't have a good, well, it's like those long German compound words, you know, that we get, because we don't have a good way to explain that in our system, which has tended to focus on more narrow areas.
Well, this is a whole other topic, but is this a problem of specialization? Is that perhaps there's too much looking in one area?
I think so, to some degree.
That's why maybe it's good to have your general practitioner along with a specialist looking at the whole issue?
Yes, if the general practitioner is able to look at the whole picture. Sometimes the general practitioners, being as overwhelmed as they are relying on the specialists for their information, because the specialists are really honing in on each area, but there are very few people looking at kind of, well, you know, these are all the branches on the tree. What's going on in the root that's giving rise to all these things in the branches?
Boy, and to keep up to date with all of the information out there, and also to treat patients. How does a doctor do this?
Very difficult.
I would think so.
But you know, I keep relying on the fact that, in my opinion, how to take care of a human body has not changed in thousands of years. We have to do different things now because of technology and the way we eat, the way we live, and all these other things. But human bodies really require certain care that we've all been talked about in all the religious texts of all the world's spiritual traditions for millennia. And I always keep focusing back on what were those texts, the Bible, the Ayurvedic texts in India. We were talking about fat. One of the Ayurvedic sages wrote 2,600 years ago that you could give people heart disease by taking the fat out of the milk.
Really?
2,600 years ago. And we're talking about it's probably the absence of good fat, not the presence of other fat, that's causing the problem. And they intuited this and worked with it thousands of years ago.
Well, I think of Chinese and
Chinese medicine as well. All of these things are in those traditions are looking at, here's how to take care of the vehicle.
Wow, amazing. Okay, we're going to get the details on the speech that you're going to be giving a week from Thursday at the Smullen Center coming up. Before we go, and these programs always go so fast.
I know.
I need to ask you about oat bran. Everybody was making oat bran muffins, everything, and this is going to help your cholesterol level. What have we found
Americans are always looking for the quick fix. So how do I get around
oat bran?
Actually having to eat well. So we're talking about fiber. Fiber is very important for all of it. Now, again, I don't think lowering cholesterol in and of itself needs to be a goal. And that's what I'm going to talk about next Thursday night, why we may not be. Cholesterol may be protective, and actually the older you are, it's becoming more and more evidence that a higher cholesterol is protective.
Does this tie in with Alzheimer's and the
Alzheimer's
aspect?
Diabetes, even, certainly cardiovascular disease, cancer risk, all of these things. Cholesterol may actually be protective. as you get older. So if you get older and you don't have heart disease, there are actually some studies that show the higher your cholesterol, the longer you live.
And are we talking good cholesterol as well as bad cholesterol?
Even total. No, that it made no difference. Made no difference in many of these studies.
All
so
right,
to just take oat bran.
Muffins, I need to know about the muffins.
Well, no, because it's processed carbohydrate and sugar that's going to promote inflammation. I'd rather you get it from fibrous vegetables. Get your fiber from leafy greens and vegetables rather than oat bran muffins. And you can't shortcut it because we get all of these wonderful other compounds that are antioxidants that help decrease the consequences of inflammation from all the different colored vegetables that we eat.
All right, you mentioned briefly omega-9s, which you said is actually olive oil.
Well, it's all called oleic acid, and that's the main fat in olive oil, olives, and avocados. And for anybody with diabetes or pre-diabetes, those foods are literally medicinal. I've had people, as long as they did enough olives and avocados and olive oil, didn't need to take their diabetic medication.
Oh, wow, that's amazing. Now, we've heard the Mediterranean diet, which is high in olive oil.
High in olive oil,
I'm not
correct.
talking about the advertised Mediterranean, but the diet that those in the Mediterranean
yes,
does have a lot of that.
Although people really looked at it, debate, well, there is no one real Mediterranean diet, but what they are doing is much more healthy fats. Certainly no processed fish. Some chicken. They don't eat a lot of red meat, but I don't think red meat is the problem either. And there are tribes in Africa that eat nothing but red meat and have zero heart disease. Now maybe it's genetics, but still things that are looked at along those lines. But they're eating whole foods, not processed. They're eating lots of vegetable oils. They also, I had the good fortune to be in Italy back in 2006, and I see people who are obviously in their 80s riding around in bicycles on the beach towns and all that. They never stop moving. They don't live the same fast-paced life that we do. They're walking when they can. So all of these things, and quite frankly, being happier likely plays a role in decreasing heart disease as well as having a social support system. I wish we had time to talk about some of the interesting stories along that line, but even just, again, the stress issue, feeling socially connected, and all that may also play a role.
Well, and you had mentioned that's one of the big factors is that whole, our lifestyle, stress, and all the rest. Since a lot of people have been prescribed statins, what do you think in general of the different kinds of statins? Are there any better than another?
No.
Do you have a concern?
No, and my concern and what I will talk about is that the evidence that taking statins to prevent heart disease, if you haven't been diagnosed, accomplishes very little, is what the studies actually show. There's some benefit. It's not nearly what people have been led to believe. And in fact, in women in the elderly, there's actually no concrete evidence that it accomplishes anything.
But they do lower cholesterol numbers,
yes, but the whole point is not just to lower your cholesterol number. The point of doing this is to prevent heart attacks. That's not really happening.
Even with the lower numbers as they've been brought down?
Exactly. And in fact, one study with a drug that combined a statin with another drug, and they were measuring carotid artery there, the people taking the medicine got worse. Even though their cholesterols went down, their arteries did worse over the study to the point where they actually had to stop the study early because it was clear they were doing harm to people.
It was doing harm. Wow.
So despite lower cholesterol, their arteries were getting worse.
Amazing. Dr. Joel Klein with Ventana Wellness, our guest. Wow, you just get into a subject and we feel like we just tapped into it, but you're going to be talking more about it. Give us the details a week from today.
So a week from tonight, at Smullen Center at 7 o'clock, both Nisha Jackson and I will be presenting on issues. I'll be talking about the evidence where what we've been taught about cholesterol is not necessarily true. Nisha will be talking about other issues about particularly hormones, obviously, since that's her big area, and how these can also affect heart disease.
Okay, great. Well, thanks for being with us, and you'll have to give us a review of the reaction of the crowd.
Oh, I'm looking forward to it.
Let me just mention, you need more info, call us here at theDove, and we can let you know about that. Thanks, Dr. Klein.
Great. Thank you, Steve.